Hey, everyone. Welcome to today's session. We are doing a Charge What You're Worth session. I have Dr. Larry here. And as all of you know, let's see, I got to get this scrolling on by on the bottom. If you are wanting to apply to win a free Charge What You're Worth session, go to freenfamoneycoachingsession.com and you can apply. So I just wanted to give you that real quick. So we're going to start right away. I want this to be laser focused and stay tuned because you'll see toward the end what happens and breakthroughs that get to happen. And it'll give you a lot of information. Something I noticed that isn't very common is to get to see lifetime coaching. And so people go, it's kind of a mystery. So I want you to know what happens behind the scenes of helping people have money transformations. And Dr. Larry applied, he won, and here he is. So Larry, let's start first with, I want you to articulate your problem. Like, what's your number one problem in terms of charging what you're worth to the best of your knowledge at the moment?
Okay. Well, there's a transition from my chiropractic practice to remote coaching. And in my chiropractic practice, I charge $65 for a 15-minute visit.
Okay.
And my challenge is transitioning that to the same hourly rate, which would be $260 an hour, and sort of transitioning to, oh, it's only $65 for a visit versus, oh, it's $260 an hour for coaching. And I'm not having too much of an issue in that ask for the $260 an hour, but I'd really like to get more into doing a upfront 3-month program, 3 or 4 month program, charging upfront for that. Normally I'd be like, well, let's do a session, let's do weekly visits for a month, and then we can go to every other week, that kind of thing. But people do a month of coaching and then they're like, I'm doing really good now. I think I could do that on my own. And I think they could use quite a bit more support. So I think it's going to that little bit higher ticket, 3 or 4 months rather than just a $65 15-minute.
Okay. So let's get really clear. I want to make sure that I know your exact problem because, obviously we can only work on one thing today, but what I hear you saying is that you want to go from, like, you've created your hourly rate based on your clients they do one session at a time. So most chiropractic clients pay for one session at a time.
Correct.
And then in your coaching, you thought, okay, well, I calculated my hourly rate based on them being $260 because it's 15 minutes, $65. She did the ratio. But you see that the people that come for your coaching, that they need 3 months, or are they actually getting the transformation they need within a month?
Everyone's different.
Okay.
Usually I'll do an initial consult and, are we dealing with an upset stomach or are we dealing with a 10-year history of gut issues? So I think some people can benefit from just once a week for a month, but others would benefit more, when you're dealing with belief shifting like you are and going deeper and looking at traumas and anxiety. It does take a bit longer to make lasting change.
Okay. And
so
we'll talk about package structure, a little bit later. What I want to know is, like, why do you feel like it's a problem that you aren't getting people to commit to the 3 months?
Yeah. I have had people commit to the 3 months, and that's a really good question. I think that's why I'm here. I feel like it's just a lot easier in the short term to say, well, let's start with this, see how things go. It's a smaller level of commitment. Let's just do a month, and then we can continue depending on your needs. Okay. And that's really kind of more the model I use with chiropractic. But with chiropractic, it's very much more cut and dry. You've got a musculoskeletal issue, you're feeling better, things are moving better, you're great. You're good to go as needed. Whereas with the digestive coaching, looking at physical and chemical and emotional aspects of it, it's much more, there's a much often deeper issues going on.
Oh,
And so there's an assumption based on experience that it's going to take a bit of reinforcement and a bit of training to develop new habits, new ways of being, new beliefs, working with your nervous system and toning down
yeah.
anxiety. So there's more to it.
Okay, so what I'm going to say already that I know to be true for you is that you are afraid to ask for the upfront commitment of the 3 months, even though you know that's exactly what people need.
That's correct.
Okay. Okay, good. Got it. Okay.
It's a bigger ask,
Yeah.
and before it was more about um, I've never been a coach before, and I've just been doing this. And do I really have confidence that, what I'm doing is going to work for them, or that I even know what I'm doing? And
Yeah.
after a few years, I'm more confident now, but I still have that old kind of belief.
Yeah, totally. I mean, God, this happens to every entrepreneur I know, including myself. That feeling of it's like imposter syndrome. It's just
Yeah,
classic imposter syndrome, right? Where you come in
yeah,
and you go, I don't totally know what I'm doing. I'm not sure if I can get you the outcome. And so I'm going to kind of undervalue myself to prove that I can charge that amount. And then once I
right,
prove it, now I've created like maybe a year or two of beliefs around, oh, people now have paid this lower price and they haven't stayed in for 3 months. And then it just recreates that cycle. So then it feels a little scary to, or it feels a lot scary to then recreate a new program and say, and stand. It's like staking the claim, planting your flag in the ground and going like, I know I can get you results. And I know
right,
that it takes a minimum of 3 months. So if you want to work with me, that's where we're starting. Right.
right, correct. Yeah,
Okay, cool. So
yeah.
that's what we're gonna work on. So tell me, I want to know, why do you care about helping people with gut health? Like what happened there for you? How did that come to
Well,
be?
it started with my own gut issues. Since I was 10 years old, I've had Crohn's disease. The Crohn's disease as a child motivated me to get into healing. It motivated me to discover acupuncture, and I got certified in that. I learned about meditation and how it works and helps with gut issues, and became a yoga and meditation teacher. So, all along the way, my trainings, my certifications were all motivated and inspired by my own success with
Yeah.
those.
Wow.
So it's all rooted in my own discoveries, my own successes, my own experiences, and just wanting to share that with others.
Wow. So 10 since 10 years old. Like,
Yeah,
wow. And I would imagine when you were 10, like there were very many solutions at the time.
yeah. There was nothing really, just some cortisone, just some prednisone, and that
Wow.
was pretty much it. Yeah. And doctors at 10 years old, when doctors say to you, there's nothing you can do for this, you sort of take that on as a belief.
Yeah.
Even with all the training, you still go back to that, you know, 10-year-old being told that. And
Yeah.
and a lot of people have that similar experience, being told, no cure, nothing you can do,
Yeah.
which is furthest from the truth. So it is really exciting to introduce people to not just diet and nutrition, but how to manage their nervous system with yoga and meditation, and how to explore your subconscious for blocks to your blocks, subconscious blocks to healing and triggers. So
Yeah.
it's very exciting work, and I love it.
Yeah.
And each time I get out of a session, I'm that reinforcement is there that this is great work and this is really
Yeah.
exciting. So,
Yeah.
but yeah, it's still that kind of money beliefs.
Yeah. Well,
holding things back.
something that really strikes me when you say that is like I'm thinking about the 10-year-old boy who's like helpless and feels like, I mean, it would did it cause like stomach aches and stuff like that?
Yeah.
Yeah, so like can't go to sleepovers or feel scared about going to sleepovers. I mean,
Mhm.
my
Mhm.
daughter growing up had a lot of stomach stuff related to anxiety, and it was like it was life altering. You know, it was like school was a problem, sleepovers were a problem. It caused
Yeah.
challenges with everything, and so it's like solving that problem is huge for
And
people.
at that age,
Yeah,
really what's at the top of the list is feeling different
yeah.
and feeling broken
Oh,
compared to your peers, and not realizing at that age that everybody has challenges and everybody either does or will have similar challenges in their life, and it doesn't mean you're broken. And so so that emotional component is a big part of it.
huge. So do you realize that the gift you give to people is for them to not feel broken and different when you help them heal their gut?
Yeah, I'm getting there. I am realizing that. Yeah, that's
Yeah.
great.
Like, I want you to tap into what's the benefit. I mean, it makes my eyes fill with tears because it's like that's liberating. Like to all of a sudden go from I like a feeling of hopelessness, helplessness, you said brokenness, feeling different, and then
Hmm.
like, oh my God, I have control of my health. And the
Right.
empowerment you feel from that, that's
Hmm. I
huge.
think that's what people with digestive issues, when I ask them what's the number one thing that they would like to get out of this, they say control.
Mm,
They feel out of control. They want control of their health. They want control out of what they eat. They want control out of their time.
yes.
Yeah, that's a
Yeah.
big one.
Yeah. Yeah. Well, and freedom, like being able to not, I mean, it's like anytime I've had a digestive issue, just say like a flu or something, it's like everything is affected. Your work, your time, your job, your family, your the way you eat, your social
Yeah,
life, all of it.
yeah, yeah.
It's
And
huge.
that whole concept of kind of identifying with your issue, when you
Yeah.
identify with it, so that rather than it just being a challenge or an experience, it's more like I am Crohn's disease or I am my gut issue,
Yeah.
and therefore I am broken. And then along with broken comes shame and embarrassment and less than and resentment and anger. All that stuff comes out of having chronic health challenges.
And you're telling me you can heal this for people. Like you've healed it for yourself and when I say heal, like you've helped them be able to be in control of it and have more lives that they feel like they can control like more normally.
Absolutely, absolutely, yeah. I mean, it's really a lot of it is just
Yourself.
about recognizing that your health challenges are, it's just another experience you're having,
Yeah,
and being able to separate out from those health issues and say that's not me, that's just an experience I'm having.
right. Okay,
And
so
just
share so you're aware of it because that's I mean, really, I want you to know like what is the amount of money you would put on that recovery, transformation,
you
healing for
know
yourself?
it's it, the coach that I try and be is the person that my 10-year-old was looking
Yeah.
for the next 20, 30 years, being able to have a doctor that can give me advice on how to eat, advice on natural supplements to reduce inflammation,
Mhm.
but a doctor that can also show me how to manage stress
Mhm.
and anxiety
Mhm.
and teach me how those things negatively affect the gut. And
Mhm.
most importantly, to not feel like you're broken and you're a lot of years of embarrassment and
Yeah.
shame and not wanting to talk about it.
Yeah.
So really, that's invaluable having someone that's a
Yeah.
private, personal doctor, yogi, meditation coach, friend, cheerleader. It's a
Yeah.
big deal.
Yeah. Okay. Okay. Like, in my mind, I instantly just go like, "Oh my god, it's invaluable." Like, the price is you've gotta up-level your price, and you've got to go, like, baseline 3 months. This is the outcome you get, because the thing you've gotta have is the mindset switch of that, like, like you're groveling and desperate for their money, and you're not sure what you're giving them, because that's what it sounds like when, when you open with saying like, "This and that, I'm kind of hesitant, I'm not
Right,
sure."
right.
Like, you can help them with this life altering issue. You have a solution, and
Hmm.
what you charge for the solution that people need and can get from you, right?
Yeah, and when you think about the money that people spend
Oh my God,
on
so much.
stuff that does nothing or
Yes,
doesn't work, or
yes.
colonoscopies and endoscopies and copays for
Oh,
medications
people spend a
and
lot.
surgery, and all of that is not doing anything. It's all just continuing to
Yes,
put a name on it, to put a diagnosis on it, but
yes,
not giving you anything in terms of. And
yes,
then when you're given drugs, uh, when you're given only drugs, it feeds into that feeling of being a victim,
yeah, right.
where
Well, and you work with people, like, are you working with people only in the Boulder area or online, like, everywhere?
no, online everywhere.
Okay. Okay.
Yeah,
So I was going to say, people are coming to someone who's a chiropractor. They're into natural medicine already, right? So you already have
right.
reduced that layer of objection of like, I can
That's
heal this naturally, potentially.
hmm
So you don't even have to deal with that objection, because some people have that. So your target market is people who are willing to pay for natural remedies, and they want a
hmm
solution, and they're looking, and they have the money for it.
Yeah, and honestly, a lot of people that are coming to me have already been to naturopaths and
Mm-hmm.
other alternatives. They've gotten diet, they've gotten nutrition, they've gotten supplements, but they still have issues.
Yeah.
And that's where it's more of an emotional
Yeah.
component that a lot of the holistic doctors aren't addressing.
Okay. Yes. And so I want you to like share a success story that you've had. Well, clearly you're a success story for yourself, and that's why you created this
Hmm.
program. Share one of your
Hmm.
success stories, because I want you to anchor in your mind that you can help people solve this problem, and then we're going to articulate, well, how do they solve it and what's the amount? Because
Hmm.
all
Hmm.
you're missing is the certainty in the way that you express it to the people that you are offering it to. Like, imagine that someone had strep throat and they didn't have antibiotics and they were going to die, and you had the antibiotics in your pocket and you were too afraid to share it
Yeah.
because you're thinking like, I'm not sure if I should share this with you. What if you say no? What if you reject me? But you could save their life. Like, that's what
Hmm.
you have, a lifeline for somebody to feel good in their life. That's
Right.
super valuable. So share
Hmm.
a
Hmm.
success story that you've had before.
Well, let's see. I had a young woman in her 20s who was suffering from IBS symptoms. And IBS is a syndrome, irritable bowel syndrome. And that means they've done every test imaginable and they say there's nothing wrong with you. But because you have all these digestive issues, we're going to call it this syndrome. And there's no treatment, sorry. And so looking at her diet, looking at nutrition, doing stool testing, blood work, just to make sure we're not missing anything there. And everything pretty good. And doing some RIM work, regenerating images in memory. It's kind of a trauma release work with the subconscious. Realizing that her symptoms began when she was 15 years old, when her parents got divorced.
Mm-hmm.
And as soon as her parents got divorced, she started having some anxiety and then started having gut issues, and that continued ever since. So, being able to identify the beginning of this was with her parents getting divorced, um, having some anger and frustration that was being internalized, that wasn't being expressed or identified. And when you have these kinds of difficult emotions that are not felt and expressed and or processed, then it tends to go inward
Yeah.
and becomes the physical symptoms of anxiety.
Yeah. It's always
And so,
uh,
right, so we discovered that, we worked with that, did some dialoguing, and helped to resolve that, and then helped her identify real world situations where that was coming up, issues with her roommates, with work, things like that. Doing a little role playing, kind of stepping back and objectively seeing how she was um, responding,
wow,
taking
so it's like a
things.
whole, how many sessions did this take?
This was about 3 months. This was
Okay.
a 3 month
Perfect.
program.
I was
Yeah,
imagining with her, it's like it takes a little bit of time to dig into the layers of people's stuff sometimes, especially when it's that deeply rooted and it starts when they're younger, right? So it's like it takes time to build the level of trust with you as a practitioner and as a gut health coach. It's like you gotta create a space and an energy, and it sounds like you're brilliant at that. And then what was her ultimate outcome after the 3 months?
she's doing great. You know, she still has issues, but she has more awareness, which
Mm-hmm.
is really all about what we're trying to create here. If you have the awareness and you can step back and see it, then you can use the tools and the breath work or the journaling or whatever to work with that, and to, over time, do that kind of belief shifting. And
Yeah.
so, and
Yeah.
we're still meeting once a month for the next few months to
Yeah.
just work with things that come up. She's been able to have some real heartfelt conversations with her parents and with her
Some
siblings.
massive transformations all the way.
Yeah, big stuff. It's been
And you would
great.
say like on a rate, and she's not here to say, but on a rating of like if her lack of feeling in control was at a 10 and for her
Yeah,
health, now what would you say it's at today?
I'd say it's probably at about a seven,
Okay,
seven
which
or eight.
is
Yeah,
big relief in 3 months, right?
yeah, big
So it's
deal.
like she's reducing the symptoms, starting to feel more in control. That's a
Hmm.
huge outcome. People are willing to
Yeah,
pay a lot
yeah.
of money to save
And
themselves.
it ends up not being, especially for a young person like that, it ends
Yeah,
up not just being about not having diarrhea. It ends
right.
up being about having life skills
Yes. Yeah.
that you take into your next job and your next relationship. And so it
Yeah.
really is setting the stage for just
Yeah.
a healthier
So
life.
what I want you to see, Larry, is the there's primary, there's secondary, and there's tertiary benefits of charging what you're worth. When you
Right.
get to have powerful results for people because they have buy-in and they're committed to working with you for a period of time, it affects them directly. So let's say the diarrhea stops. Secondary benefit. Oh, actually now I feel like I can go on dates.
Mm-hmm.
Tertiary benefit.
Mm-hmm.
Oh my God, I get to feel like I have freedom to get married now if that's something she wants. Like that's just one
Right.
example. It could be
Right.
like I'm crippled from IBS, staying at home, socially isolated, have a whole bunch of anxiety around it. And that starts to get healed. Now I can like go get a job that I enjoy. I mean, there's so many benefits.
Mm-hmm.
Start
Mm-hmm.
stacking in your brain. Benefit, 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 benefit. What's the benefit to my people that I help with their gut health so that you can start to charge what you're worth? Because the reason that we don't charge what we're worth is because we don't see the benefit ourselves. So then we
Mm-hmm.
undervalue ourselves. And when we go to ask for money, we freak out internally, subconsciously, and we go like, I'm not sure and I don't know and I'm not certain. And people are buying your certainty about their transformation, right?
Right.
To
Right.
you as the expert, and they want you to say, here's what I have. It's guaranteed that at the end of this 3 months you will feel more in control of your gut health, which
Right.
which gives you these top 5 benefits in your life, right?
Right.
Like feel more in control, stop feeling broken, stop identifying with your disease that you've been told you have, which means you get to like feel more freedom, go on trips. Like, I mean, this is crippling for people. I know I've seen people in my world be crippled by their gut health. So
Yeah.
that's a powerful, powerful, powerful
Mm-hmm.
service that
Mm-hmm.
you offer.
It's
Okay.
true. So, in hearing you say this, it does make more sense to me that structuring my program, that comparing that to $65 for an adjustment is
Right.
apples and oranges.
Totally. Like you can't.
So you're getting adjustment, you're getting rid of their neck pain versus
Yeah.
creating a whole life shift.
Totally. And so the mindset switch you need to have is I don't want you to even think about it as dollars for hours. Like, don't think about it.
Right.
You're thinking, what is the value of the transformation I'm offering you in this program that I have? And here is the program. We're not like going, oh, maybe it's this, maybe it's that, maybe you see me for 3 weeks and then we'll see what happens. You go, I'm only willing to work with people who are in it for 3 months minimum. Here's the 3-month package price, and then after that, we'll design a plan tailored for you
Hmm.
based on where you get in those 3 months. And then,
This is a big thing about where I'm getting trapped is
yeah,
because I would say, okay, 3-month program, 4,000, but then I would start doing the
yeah,
math
yeah,
and going, oh man,
freaking
that's
out.
$500 an hour. I mean, oh no, that's crazy,
Right. And so
instead of
because you're thinking that when you're talking to people, you're unconsciously projecting your money fears onto them.
totally,
So they're feeling that energy. It's invisible, but it's there. And then they're going, well,
yeah,
he's not certain. Should I buy into this? I'm not sure. Instead of you coming with certainty of going, I'm positive, I know because I have a track record of success for myself and the people I've worked with, that I can guarantee at the end of this, you will feel this, and this is the price for this package. Then you're going to
hmm
start to gather a whole bunch of awesome testimonials because you know you can deliver, and then you can keep upping your price as you choose. And then
hmm
you become, that's how people, but they're not going to buy into that if you aren't standing firmly in your certainty about that.
yeah,
And so, and what happens when it's like, I think of it as scattered energy when we go, oh, one client I charge this and another client I charge that. And then they don't get results. And then it reconfirms your fear about you being an imposter, right?
hmm
Instead of going, when someone buys at a higher dollar amount from you and they get a powerful result, they become your best salespeople, right? Because all of
right,
a sudden they're going like, I got awesome results and I'm going to tell everybody about Larry because he is awesome and holy cats, life transforming, right?
hmm
and
hmm
and that's because they invested in themselves and they believed in you, and you believe in yourself, and you show up more powerfully when you get the amount of money that you're asking for and that is worth it because of the transformation you deliver. Have you ever noticed how when you undercharge you start to kind of resent those sessions?
absolutely,
Yeah,
yeah,
you show up and you're like, and then you don't deliver powerfully. They don't really get the result. And then again, it feeds the unconscious loop of you
hmm
believing I'm an imposter. I don't know what I'm doing. I'm not a good coach. And it keeps going, right? So
right,
instead, every time, like I want you to create a package that's 3 months minimum. It's this price, a very specific price. You don't do the in the moment of the console, I'm going to change my price because I'm projecting that somehow your money story is this, right? And
right. And I did do that when I started coaching. I did create the package.
good.
This is what it includes. I sold it. They bought it. It was great. And
Yeah,
somewhere in there, I
yeah,
started kind of, oh, I had a couple of people like, oh, I can't afford that, or oh,
yeah.
there's no way I can do that. And after a few of those, it started kind of chipping away at
Yes.
at my
So it degraded
confidence
your
a little bit.
confidence, right? Okay. So
Yeah,
your job when you have those clients who make objections is to remember your benefits list. So I want you to like write a benefits list to your
that's a great idea.
and you just every time you get on a consult you read that benefits list and you keep adding to it. Like I have a benefits
Hmm.
list of 200 benefits I bring to my clients so that when I go into a consult I have zero doubt in my mind that I can help them in my area of expertise, right? Like I know I can help them heal their money story and transform their relationship to money, charge what they're worth, make easier money. I know I can do those things and I know what it's worth to them. So when I go
Yeah.
into a consult I'm confident. I'm like, here's the result you're going to get, and this is why I charge top dollar, because one thought shift I give you can bring you millions of dollars.
Mm.
Deal. That's worth a lot of money, right?
Hmm.
And you can
Hmm.
feel my certainty with it. I don't falter. I don't go like, oh, I'm not sure. I don't know. And then maybe it's this and maybe it's that, because then they get confused and confused people don't buy, right? You want
Right.
to feel certain. So have that list with you. And then remember, when people bring up objections, it's usually them going, I don't see the value yet, right? And so you just
Hmm.
tapped in enough to them understanding their hotspot, right? So it's more conversation. Some people authentically might not be able to pay $4,000 for a 3-month program, maybe. Most
Hmm.
people, though, do, and they will come up with the money for what they see as valuable. If they believe in you and they know, I've had a lifelong problem with gut health, and Larry's telling me he has a solution for it, I'm going to find that money because that
Hmm.
sounds like it would be life altering. And he's telling me this and this and this, and he guarantees that by the end of this, I will have solutions to this issue that's life
Hmm.
altering for me. Then we'll find the money, I promise you.
Right. Right.
So people buy what they're
Nice.
so so
Yeah.
so
The
let's
benefit list is great. I'm going to
yeah.
do that.
Yeah. So let's end it with, and thanks for being here, everyone. If you are wanting to apply for a free session that you can win to do exactly what we're doing right now, go to freenfamoneycoachingsession.com. The reason I'm doing this for free is not because I always do free coaching. It's funny having a charge what you're worth and then go, I'm going to a free session. It's because for me, it's a win-win. It helps people see what it's like to work with me live time. And so then, they go like, oh my God, I want to work with you more. So, this is a mutually beneficial, it's a win for me, it's a win for Larry, and it's a win for you watching. And then it's a win for my long-term business growth where, in my Charge What You're Worth boot camp, you've seen a little bit of what you get from me here and you're like, oh my God, cool, I want to work with you. So apply to win. So Larry, let's end with you. What are you committed to? One thing that it stood out that you said at the very beginning when you said, I'm trying to be the coach that my 10-year-old needed, like
Yes.
eliminate the word trying, because you
Yes.
are being the coach that your 10-year-old needed. Like, you are a powerful, powerful practitioner. You heal people, you help people, you help them transform their health. I know this about you. And,
Hmm.
you're sharing your success stories. I know you've had many of them. So own that powerfully. You're not trying, you are doing it. So what are you committed to creating in terms of a package now? And what are you going to stand firmly in the future?
I am committed to a minimum 3-month package.
Nice.
I am committed to being able to spell out the benefits that people will get from that package. I will have a specific, clear, non negotiable fee for that package and a specific ways to make those payments.
Awesome.
And and uh, and committed to stick to it.
I love it. Awesome.
Yay!
Good for you.
Thank you.
My work is done here
Yay!
for
This was
today.
great. Thank you.
Awesome. All right. Thank you so much for being willing to come on. I know it's interesting probably to be like, I'm going live time. It's pretty vulnerable. So thank you. And thanks
You're so
everyone for
welcome. Thank you. This was
watching.
great.
Go ahead and stay on, Larry. I will. I'm just going to say goodbye on the live. Bye, everyone. I'll be back with the next Charge What You're Worth session soon. And of course, because you're watching this in the lab, leave some comments. Let me know what worked for you here, what questions you have. I love to answer your questions about all things money making to help you up-level your value, make more money in your business more easily, so you have more time and money freedom. So I'll see you next time. Bye, everyone.